Seth, what's going on?
Good morning, Stefan Reese and all of our viewers. So,
Yeah,
myopia, very common
Myopia.
condition. Yes, of course, the word, when you go back to the Greek meaning of the word, it basically means closing the eyes or squinting of the eyes. And it's something you see a lot with a lot of people that would be squinting to try to see something. So it's nearsighted vision, nearsighted vision. And strangely enough, well, not, I shouldn't say strangely enough, but to me it makes sense. But it's carded by the year 2050, over 52% of the world population would be suffering from this condition.
Serious?
Now, yeah. They say mostly it might be, caused by people spending a lot of time indoors, doing a lot of reading, all right? And, I find that interesting and due to, social media or being on their phones and so forth. And I find that to be quite interesting because I don't think that's the only reason. And, of course, the other additional reason has a lot to do with environmental factors, of course, along the lines of nutrition. So what I'll do here, I'll just, share my screen so that we could get to see a little image of this condition. So it would make a little more sense as we look at it. So here we have two images, all right? The first image on the left is an image of the eyeball, with myopia, and the second image is the normal eye. And as you can see, let me make sure my highlighter is available here. You can see here when the light rays are coming in, so when you're looking at an image, and it has to pass through the cornea and then the lens, right, through refraction, the focal point has to be to the back of the eye on the retina. Now, somebody with myopia, if you notice in this diagram, the focal point doesn't reach all the way back. It stops short. And that can be due to either issues with the cornea not being curved correctly or the lens. But the majority of the issue has to do with the shape of the eye. So some people's eyeball isn't shaped correctly. Now, it might be hard to see, but in these two images, those eyeballs aren't the same size.
They bring it full screen so now I can see it. Thank you so much. Yeah, go ahead.
Right? You're seeing that the eyeballs aren't the same size. The one on the left is a little bit larger, more elongated than the one on the right.
On the right, yeah.
Right? So, because of that, the focal point doesn't reach all the way to the back. Now, you have hyperopia where there are people that are farsighted, where the focal point reaches behind here. Right? So that's why they could see further, but they can't see things at close range. So it all has a lot to do with the focal point, and it's supposed to be able to reach the retina, and that's where the focal point is supposed to be. Now, you know that in the retina you have the nerves and stuff that would convert the image and relay it back to the brain, but if it is not reaching, then you would get a blurred image. All right? So that is what is happening. Now, we have to understand something with the eye as well. Your eye is made up of tissue that are like muscles. So there are parts of the eyes that contract and stuff to change the structure of the lens so that you can adjust to see things better or not. So you can focus. It's almost like with cameras, where you turn in the lens of the camera in order to get things in focus or out of focus and so forth. Which means that this issue has a play with regards to muscles. With regards to muscles. In fact, from studies that have been done, because this condition affects females more than males, and in studies that have been done on females with this condition, during their menstrual cycle, their eyeball changes size at different intervals. Right? So yes, your eyeball changes size. Now what that tells me, because they're saying that, in this condition you could use corrective lenses or laser surgery or whatnot for the eyes. But I could tell you this, from people that I have encountered, people that have started my program, people that have done consultations with me and made the changes to their diet and lifestyle, their eyesight have improved. I know of
Okay.
a guy that told me, this was since the year before, right? He said he made certain changes to his diet from watching me on the program. And at 61 years, he had to revert back to his first pair of glasses because his eyesight continues to improve.
Right.
So eye health has a lot to do with nutrition. And a couple of weeks ago, when we were looking at the vitamins, we were looking at vitamin A because we know that vitamin A plays a great big role with regards to eye health. Now, having said that, of course, I would say again, I am not and would never be an advocate for supplementation.
Supplements. I don't believe in the supplements.
Supplementation, let's look at it. If the world now is suffering from myopia, and by the year 2050, over 52%, currently is around 30% of the world is suffering from myopia, and they said it's estimated to reach 52%. And with most people on supplements, clearly, supplements not working.
But let me ask you something. Let me ask you something. I was talking about the eyes, right? Let me ask you something.
Yeah.
And we're talking about nutrition, all right? And we're talking about, okay, you have a client that has locked into one of your programs and their eyesight is improving. So here's my question now. All through the years since I was a little boy, I always hear carrots good for your eyes. Right. So let me just ask you about that one time. Because they say carrots have something called carotene, and the carotene is good for your eyes. But I know while you don't believe in the supplement aspect of things, you also don't believe in the plant-based foods like the veggies and things like carrots.
Well, what I want to do is correct the term belief, because belief gives an idea of a subjective opinion. Okay. So it's not a subjective opinion I have on the matter, it's some scientific fact. So let me explain quickly. Beta carotene is what you get from things like carrots, from plants. What the body needs is retinol to convert it into retinoic acid. Retinoic acid is the most active form of vitamin A, and that is what the body needs. Now, plants have beta carotene. Beta carotene is 12 to 24 times more difficult to be converted into retinoic acid. Also, to convert the beta carotene into retinoic acid, you need zinc, right? So zinc is needed. The problem with carrots is carrots also come in with phytic acid. Phytic acid is one of the ways in which plants stores phosphorus, right? So phytic acid combines with minerals in your digestive tract to produce phytates. And the minerals it binds to is calcium, magnesium, iron, zinc, chromium, and manganese. Once it binds to it, it forms phytate, and your body therefore no longer has access to those nutrients that it binds to. Now you need zinc in order to convert beta carotene into retinoic acid. But carrots come in with beta carotene and it comes in with phytic acid, which blocks your body's ability to convert the beta carotene into retinoic acid. So that reminded me of an old boss of mine years ago. And his mom suffered from eye issues. So he started to juice a lot of carrots out of fear. You know, that happens to some people, to see a family member suffer with an eye issue. So he started to juice a lot of carrots, eat a lot of carrots right through, and then started to develop eye problems. So he had to cut off the carrots. And when he cut off the carrots, his eye went back to normal.
Serious?
Right? Yes.
Because
so
to be honest with you,
things,
to be honest with you, when I was 11, I knew that I was nearsighted, right? And I started to eat, I just go in the fridge and eat a carrot, right?
Yeah.
Because you always say that, eat carrots and good for your eyes. But my eyesight never improved. I just want to put that out there.
So,
it never
and what
improved,
I want to tell people,
so I just stopped eating carrots. Yeah.
And what I want to tell people, not because it has a particular nutrient or mineral in it, means that it is bioavailable. And when I use the term bioavailable, I mean your body is able to access it. So it doesn't mean that because it has it, your body can access it. And this is where a lot of people are misled, right? They think, oh, this is high in this. But it's high in this, yes, but can the body access it? What else does that food source, or what people might call food, because I don't call those things food, but what else does that come with? For example, nicotine has a lot of health benefits. But tobacco doesn't come in with nicotine alone. Tobacco comes in with at least 90 other harmful toxins in it.
Yeah, different types of chemicals
Right?
and stuff, yeah.
Exactly. So when you're thinking, yes, this have this in it, what else does it have? And this is where most people are misled, because they look at the pros and they don't ever look at the cons. So they are consuming something that is causing more harm to their body. And they don't know. And then when the harm happens, whether it manifests through disease or illness, they think it's just a symptom of old age, or this is just something that has randomly affected me, or we call it a idiopathic disease. There is no such thing as idiopathic. Idiopathic disease means I do not at this point in time know what is causing that issue.
Okay.
Right? But people think, no, it don't have a cause. No, it's not that it don't have a cause. You just don't know the cause.
You just don't know the cause. Yeah, you don't know. Yeah, you don't know.
Right?
It yet.
You haven't identified. But there is a cause. There is a cause for every disease. There is a cause to every sickness. Of course, what I do at St. Wiles Holistic Health Clinic, we deal with the root causes of the disease. The root causes. Right? Most people are into symptom suppression, and once you're going along the path of symptom suppression, you are going to make things worse for yourself, because suppressing a symptom is not dealing with the root cause. That is just giving you a false sense of security that you are feeling better now in the moment, but you haven't dealt with what is causing the actual damage to your system. So what is causing damage to your system continues to cause damage while you take this symptom suppressant. And that is what medication is. Medication is symptom suppression. And that is what a lot of people have been doing and have been groomed to do.
Yeah, it does. It does suppress, because I mean, you have the cold, you take 2 tablets, it eases up the runny nose, but it doesn't get rid of the cause. I always tell people this simple thing: a cold or a virus, it must pass through your system. It's going to pass through your system.
When you suppress the symptoms, you're suppressing how the body is trying to get rid of it.
You're kind of counteracting what the body is trying to do, because your immune system already kicking in. So it has to pass through your system. Some take 3 days, some take 4 days, some take 5 days, depending on the strength of your immune system too, and how you keep yourself.
Exactly. Now, if you want to strengthen the immune system, you want to eat correctly during that process. So, like in my case, I just probably get the cold, but I don't know. Because my immune system is strengthened to the point that when it's getting rid of those things, I am unaware of it.
Yeah.
And that's what you want to do.
And then the first thing people look for is vitamin C, and the first thing when they're looking for vitamin C, they turn to juice.
Right. That's a good way to end up with kidney stones.
You see how the thing does go. So Seth, we all the time, but just in closing here, in terms of myopia, just some closing thoughts on that for anybody interested in getting
with myopia,
assistance.
Because many also believe that it is genetic as well. But remember, I mentioned in the past that it has something called epigenetics. If you are consuming things that are blocking nutrients from your body, blocking your body from absorbing nutrients, then when you have offsprings, your offsprings are going to end up with these deficiencies as well. That is going to affect gene expression. And that could set them up or have them predisposed to these health issues, because the parents weren't eating well, and then the parents were deficient, and then these parents have offsprings which were born more deficient than the parent. Right. And that would affect the genes of the individual, which can be rectified, but is not easy to rectify. All right? So it can be rectified, but it's not easy.
So I tell you what.
So I would encourage people, book your consultations, come, let me explain nutrition to you, get a fuller understanding of what you're supposed to and not supposed to eat, and that's the best way to go forward with regards to living a healthy lifestyle. All
right, nice man. So Seth, thanks a lot. People, if you want more information and want to book that consultation, you call him on 7611952. That is 7611952, or 2793935. That is 2793935, and get a consultation going, and then, like we say, you make the decision. He's going to give you all the information that you need, and you go forward from there. All right, sir. Thanks a lot.
Thanks for having me.
No problem.